Hello. We do have some pre-video questions today. The first question is, gestational diabetes or diabetes during pregnancy is a risk factor for type 2 diabetes, true or false? The main function of glucose is to give energy to the cells of our body, true or false? Blindness is a complication of diabetes, true or false? Hello, my name is Nathan Kakish, the Medical Director of the Cultivating Health Ministries Outreach Program, and we are going to be talking today about diabetes. What is diabetes? Diabetes is a disease in which the level of sugar or glucose in the blood may be higher than normal because the pancreas produces too little insulin, not enough or no insulin, or the body prevents the insulin that is produced from working properly. And in the schematic on the side, you see the location of the stomach with the pancreas to the side, and the insulin flowing into the bloodstream, which would normally cause the blood sugar to be lowered. But when there is not enough insulin, or very little insulin, or the insulin is not working well, the blood sugar continues to rise, and the pancreas and the body are unable to lower the blood sugar. What does this mean? If you have diabetes, sugar cannot enter your cells and stays in your blood. This causes your sugar in your blood to be too high. This is a term called hyperglycemia, when there is too much sugar in the blood. What is glucose or sugar in the blood? Glucose is a simple sugar that circulates in the blood after eating foods, especially those that contain carbohydrates or simple carbohydrates such as breads, tortillas, soups, flours, starchy foods, legumes, fruits, and some vegetables. The main function of glucose is to provide energy for the cells. It is similar to the concept of gasoline for the car. And the schematic on the left illustrates blood sugar in the bloodstream at normal levels and excessive levels. The risk factors for developing type 2 diabetes include a previous diagnosis of prediabetes on laboratory data, being overweight, age over 45 years old, a strong family history of type 2 diabetes, a sedentary lifestyle with little physical activity, gestational diabetes or diabetes with a pregnancy, or having a baby with a birth weight over 9 pounds. And some ethnic groups are more predisposed to type 2 diabetes, such as African Americans, Hispanics, American Indians, and Asian Americans, Pacific Islanders, as well as the elderly population. Type 2 diabetes signs and symptoms. There are a few subtle symptoms that include weight loss that can affect some patients with type 2 diabetes. Excessive thirst and feeling of dry mouth is often a common symptom of diabetes. Unceasing hunger or increased appetite can be a sign of developing or worsening diabetes. Chronic headaches or fatigue, and the cotton feeling of the dry mouth that drives a lot of thirst feeling can be a sign and symptom for diabetes. If you have any of these symptoms, we do ask that you seek help to help diagnose if you have diabetes. Type 2 diabetes is diagnosed once a patient's A1C is 6.5 or above. The A1C is a test that detects your levels of blood sugar over the last 3 months, or a fasting blood sugar of 126, especially with symptoms of diabetes, or the results of a glucose tolerance test of 200 or higher, which is a test conducted after ingesting a high sugar solution. Prediabetes is defined when the A1C is 5.7 to 6.4, a fasting blood sugar of 100 to 125, and a result on a glucose tolerance test of 140 to 199. Normal non-diabetes numbers are an A1C of 5.7 or below, a fasting blood sugar of 99, and a value of 140 or below on a glucose tolerance test. The treatment for type 2 diabetes, first and foremost, include a healthy diet and physical activity. Those food options that are lower in carbohydrates and physical activity do help to maintain and lower blood sugar levels. Oral medications may be appropriate for some patients, and injecting insulin may be appropriate for others if they are no longer producing enough insulin. And type 2 diabetes usually gets worse over time. Even if you don't need medications at first, it may become necessary later as the disease progresses. Complications of diabetes are multiple, and they can be serious, costly, and deadly. They are more common in patients with poorly controlled diabetes or those that have a long-standing history of diabetes, especially poorly controlled diabetes. Cardiac diseases are a common complication, including blockages in the arteries to the heart, causing heart attacks. And brain strokes are another common complication where the arteries to the brain become blocked and cause too low blood flow to the brain tissue. Neuropathy, which is damage to the nerves going to the tissues, especially into the legs and feet, are a common complication. And so are nephropathy, which is a condition where the kidneys and the filtering mechanisms in the kidneys become damaged due to the long-standing diabetes. Another complication affecting the eyes includes blindness, and in patients who have poor blood flow to the feet, especially, sores, infections in the feet can lead to amputations to the toes or the feet, depending on their severity. The current recommendations we recommend for patients who have diabetes is to try to register for classes to help with diabetes self-management, including any community resource that can empower the patient to help manage their diabetes. We encourage patients to collaborate with their doctor, nutritionist, and pharmacist to get maximum control of their blood sugars and their A1C readings, to constantly ask about new medications, new developments, and medications that have other benefits for patients with diabetes. And we do encourage patients to look for support from your family, friends, local support groups, local charities, and social support networks that will be available for patients with diabetes. Post-video questions. Gestational diabetes or diabetes during pregnancy is a risk for type 2 diabetes. True or false? The main function of glucose is to give energy to the cells. True or false? Blindness is a complication of diabetes. True or false?